Experts define non-communicable diseases, NCDs, as diseases that are not transmissible directly from one person to the other. NCDs account for more than 2/3, that is over 60% of global deaths. They are, for the most part, caused by lifestyles and genetic factors, and are four broad categories of these diseases: cardiovascular disease, cancers, diabetes, chronic respiratory diseases, and so on and so forth. Sadly, 80% of NCD's deaths occur globally in poor, low-income countries, such as ours, where health indices are indeed low and commitment of budgetary allocation to health is sadly very low. So we have to contend with communicable as well as non-communicable disease. Well, with this situation, the older generation of Nigerians have huge NCD issues plaguing our nation today. You're talking of cancers, diabetes, and whatever. Today, however, can we keep our youths away from the crutches of NCDs because of our health system is fragile, and our youths are making same and in most cases worst lifestyle choices as the older generation. How then can we not doom the youths to the same fate that is ravaging low-income countries? Because, like it or not, we are a low-income nation with high poverty index. Safeguarding our youths from the NCD's trap is the focus of this episode of Bridges. So I welcome you on Bridges, and I hope that we will be able to build a solid bridge that will contain, if not put at bay, non-communicable diseases, particularly with our youths. And I have the youths here today to speak to these very important health topic. Now, my immediate right is Aloysius Chidibere Ugu. He is an advocate for better health among youths, and is also, should I say, you're also a media practitioner?
Yes,
in the health space.
And a program analyst.
And the program analyst. Next, I have Nkechi Dim. She's a legal practitioner, and she's here with us. Thank you very much for coming. Two lawyers, actually, Damilola Kukbola, also on my extreme right. You're welcome on Bridges. And to my immediate left is our wonderful public health practitioner, also a youth, actually, and I'm very proud of what the youths in Nigeria are doing. Kikiokpe Oluwa.
Oluwarori.
Thank you
for having me.
Yes. She works with the NGO called Education as a Vaccine, and she's head of programs. Adu Rotimi is next, and she works with Health Reform Foundation of Nigeria, where we're trying to ensure that we have an improved health system. Here we are, we're looking at health, we're also looking at the social factor surrounding health, and looking at youths particularly as we speak to non-communicable diseases, and it's on its rise now. How do we contain it using the youths as our benchmark, do we say? Or because you are all aspiring to be leaders tomorrow, you are leaders in your own rights, as it were. So how do we curb NCDs?
And really, it's very, very important at this point in time, as we move into the new decade, that by 2030 we have actually planned to attain the universal health coverage among the other SDGs. So today, talking about NCDs is very, very important for us. Also considering that we are a nation that we are actually striving to build our economic base. So addressing the issue of NCDs among young people who are actually the leaders of today and the future of Nigeria is very important. So among young people, what are actually the causes and why are we discussing NCD? There are four factors that actually contribute to NCDs. First and foremost, we have the use of tobacco, alcohol, lifestyles in terms of dietary and physical inactivities. And if we look at today Nigeria, we realize that most of these issues that we're talking about actually are factors that young people actually practice. And our environment are actually not enabling the young people to live a healthy life that will curb or help them not to be at the risk of NCDs. First and foremost, let's look at the economical space in terms of job creation, even the workspaces. We have a lot of young people that are not actually employed. I realize that most times they wake up and they sleep in the house. They really do not participate in any creative activity. And when they have to, most of them have taken to tobacco abuse. They've taken to alcohol use, which actually factors that increases, exposes them to NCDs. Now, for the young ones that are youth that actually are employed, we also look at physical inactivity. Now,
I'll just take it from you because I can see that everybody is eager here to contribute. Yes, let's quickly hear from the public health expert with us here. We're looking at NCDs and youth. Do you think is a concern? Do we have a concern?
It definitely is a concern. So I was reading a statistics a while ago that said that a WHO statistic that said that in the next 10 years to 20 years, NCD is going to be like the leading cause of death in Africa right now. And so definitely, if we're going to be having deaths from people from a certain set of people, 10 to 20 years, the youths of today are going to be the adults of tomorrow, 10 to 20 years from now. So I definitely think that it's a cause of concern. It's something that we should start addressing. She also mentioned the part of lifestyle, dietary concerns. Now, these are issues. These are things that we should consider. The fact that sometimes our feeding, what we eat, what we put in our systems, the kind of food we eat, whether it's the carbohydrates, the proteins, and then the fruits and vegetables, we are not paying attention to a balanced diet. We should even look at our parents, our elder ones. Look at the kind of things that they are dealing with now. They're dealing with liver disease. A lot of people are dealing with diabetes. A lot of people are dealing with kidney failure. We should be able to learn from all these things because all these things are precursors to, they are a result of how they have managed their life from when they were young up till now. And I think that youth should start learning from all these things and make a determination to change their lifestyle and adapt it to a healthier one.
A healthier one. Now, we should adapt to a healthier one. And I can see you are nodding there. Aloysius, how do we build this solid bridge to ensure that we do not compromise the health of our leaders to be?
Yeah, I think first of all, I need to talk about sustaining some of these lifestyles, because of course they are the right ones that the youth ought to engage in. For instance, they mentioned about dietary, exercising and all that. But the crux of it is the consistency, because you find out that some youths just take out Saturdays as the major day they exercise, not knowing that for standard, according to WHO, it said at least 30 minutes, like my colleague said here, said 30 minutes at least every day for like 5 engagements in a week. You should be consistent 30 minutes. So it has a way of dealing with NCDs if we are consistent. So it's not that you start off today and tomorrow you drop back. It's like something you do.
It has to be sustainable.
It has to be sustainable. So for us to avoid, going down
some
to some of
these diseases.
It's
exactly. Not,
So the fact the risk factors must have to be tackled, and in tackling that, we have to be consistent and sustain whatever we are doing in the positive angle to make sure that these youths don't come down with NCDs.
Okay, we had an interesting discussion before we came on air that we should also be looking at people living with disability, and that's why I'm so proud of Nkechi for coming on. She lives with disability but active, plenty of ability right there. So what are those issues that people living with disability should also consider in terms of looking at the whole gamut of NCDs?
Okay, first of all, I'll say NCDs, most NCDs are prevented, most of them. When we watch our diet, when we exercise, like you say. But when we come to persons living with disability, most of us live in abject poverty. And poverty can be seen to be the main cause of non-communicable diseases among most of us. Most persons living with disability live in abject poverty due to lack of job opportunities. most of us don't have jobs. We had an interview among women living with disability. That was just last week. And when we went to the villages, we saw a lot of them, a lot of them, and they were living in abject poverty. I could never have imagined that people like this or poverty existed to this extent.
So
It's so
that shows that it's a good environment for NCDs
It's a very
to
good
thrive.
environment for NCDs, yes, because they don't eat right, they don't have a means to exercise. Because you see people on wheelchair, when they go to the hospital, I don't know, when they want to, because one told me that she wanted to check her weight one day and she went to the hospital on a wheelchair, and she was just there, nobody attended to her, nobody. And I was like, do they have machines for people on wheelchair to check their weight? She was like, she does not know, and she was really bloated. She was very fat. She was on the big side. So our health facilities has to improve. It has to be accessible. The facilities has to be accessible. Our health environment has to be accessible, and they have to consider persons living with disability. Like Article 25 of the UN Convention on persons living with rights of persons with disability says that the rights of the health of persons living with disability has to be given maximum attention, because most of them, they are the risk of this non-communicable diseases. Yes.
Well, I know that Damilola, you've been doing a lot, particularly with mental health, and this is also one of the NCD's pillars. Now, particularly among youths, what's your thought with this discussion?
Okay, I would like to tackle it from the angle of neglect. First, there's a lot of attention that we tend to pay to maternal and infant health. Meanwhile, adolescents and youths are also a vulnerable population. So when this group is being ignored, it's assumed that every adolescent you see, every young person you see is healthy. So there's a lot of neglect going on in the society. So now, when we take it further, when it comes to mental health, when a youth, for example, doesn't exercise, it has been proven that even your mental health won't function as supposed to be, because you are not exercising your muscles. So in that way, your mental health is affected. And now, bringing it further, when we have to discuss on non-communicable diseases, we notice that when it comes to participation of youths and when it comes to points in governance in issues that concern them, they are always at the back, they are set aside. So when youths are not placed in the core of issues that are pertinent to them, there's this tendency of them just living on. And another thing, when it comes to the area of CSOs, there are youths CSOs that work on other issues, but when it comes to non-communicable diseases, it's put at the back, and then it's not brought to the forefront. So when you accumulate all these factors together, and you look at their lifestyles, they don't exercise properly, and I've even discovered, when you want to eat healthy, it appears more expensive compared to you just having Coke and bread. So when you look at all these issues, in a way, you just like, even the
society is not helping.
Yes.
So now, in building our bridge on the program today, what do we do? Let's start thinking of solutions. We now know, we agree that we have a major challenge here. Yeah. Okay.
Okay. So for us to actually curb this menace that's going to explode very soon if we don't take action, is that first, government has a role to play, the society has a role to play, and the individuals, especially the young ones, the young leaders, the young people, adolescents also have a role to play. And I remember when I was growing up, it was standard for every school to have a game arena. You must have it. It's a standard. But these days, you see schools that could barely even have a classroom for themselves. So how do those children or pupils or students in that kind of school actually have time to do physical exercise? It's not really there again. Also, in terms of workplaces need to start being friendly. You do not expect, you need to create a system where people can stand up at intervals 30 minutes to 1 hour, it should become mandatory for people to stand up. People need to be accountable. System, offices, workplaces need to be accountable to their employees, especially the young one. Now, the department that is meant to be handling NCDs in the Federal Ministry of Health, what exactly are they really doing? There needs to be more. We don't want NCDs to be discussed when there's a global concern. Issue of cancer in young people, issue of diabetes needs to be addressed, and government needs to put funding. Now, when we talk about funding, it's not funding for treatment, but funding for prevention. Now, our PACs, our primary health care centers, how well are they equipped to actually provide information to people, especially young people and adolescents, on how they can live healthy? We've actually turned hospitals to just about treatment. It should rather be about, about curative, but it should be about information and also about preventive treatment. So our PACs should be equipped to do these other later ones, not about just curative and treatment.
And so when we're talking about, engaging the youth, particularly for wherever you go, you see things around you. All you see are the billboards that advertise on, on some of these drinks and whatever that inhibits good living for youth. What's your thought?
So I'm just going to bring it down to the level of how I would talk to an adolescent and the youth. I know we all have our dreams. We all want to be the president, the director, the doctors. We are chasing the paper, in short. But I want us to know that as we are preparing for these dreams, we should also start preparing for our health. Because it will not be nice for you to be at 40, at 50, you have all the money, you have all you've ever asked for as a person, and then you are dealing with something that it will consistently be a thorn in your flesh. And let me tell you, NCDs, once it starts, you can only manage it. You may never be able to treat it completely. You will deal with it with the rest of your life. So whatever habits right now that you have, whether it's smoking, whether it's drinking, whether it's unhealthy eating, just stop it now. Make a conscious effort to live a healthy lifestyle. Incorporate it into your everyday living. It's going to be difficult, but be consistent with this. And trust me, in the next 20, 30, 40, 50 years, you will thank your stars you did the right thing.
But you are all looking very healthy here. I know now I have to do a lot, even if I think you're all my kids, but I need to keep healthy as well. So let's make a conscious effort to do that. And in doing that, what are the helps? What are the blocks that we need to build quickly to ensure that youths can buy into healthy living for a greater tomorrow? What are the kind of things that we need to do?
Yeah, I think we should, speak more on the information, passing information, health education. People, you might think that people know, but they don't know. They don't know that these are the things that would lead them to a deteriorated health condition in the future. So I think there's need for continuous passing of this information out there. And again, that is one of the things we do in Nigeria Health Watch. We try to use some of our blogs, to send those messages across to the public. So they need to know. And let's not also forget there is a place of peer pressure, that brings these youth to subject them to some of these practices that would, eventually lead to NCDs. So there is need to, while the information is going out, we begin to tackle it at that minute level, so that they will know the consequences of what lifestyle they are living.
I'm telling you, the consequences of your lifestyle would definitely determine your tomorrow. No matter how developed Nigeria is, we only would need healthy herds of leaders, which are you here seated. All right. Now, you were very passionate about, NCDs with people living with disability. Moving forward and building a sustainable bridge. What are your dreams? What are the things that all of us collectively should get involved with?
Okay. I want to say that the right to health is a general right for persons living with disability and those living without disability. It's a general right. I am a person living with disability. I try to do little exercise as I can. I skip with one leg. But then, people living, I think the gym should be accessible to those persons living with disabilities. They should have facilities where persons living with disability can also partake in food. They should have, it should be accessible generally. Then when it comes to information, information should be accessible also to persons living with disability. We should get to the stage where information could also be in braille form, because the blind also need this information. It should be accessible to them. They have a right to this information too. Then the health centers, the health facilities, it should be accessible to persons living with disability. Mammography, I heard it's done while standing, I heard. But I don't know how someone sitting on a wheelchair can do a mammography here in Nigeria. I know in developed countries they can do it. They have a way of doing it, but in Nigeria you must do it standing, like I heard. So I think these things we
So
should
diagnosis
develop in
might
our,
go wrong.
exactly. We should develop in our health services, in our health centers.
Damilola, we have you, then we have 2 seconds for what we should do with youths and what you think the youths will appeal to the youth in moving forward to contain NCDs. Yes.
Okay, so I'll just like to take 2 angles to it. First is innovation. We have to come up with innovative ways to include persons with disabilities, to include youths in our programs. For example, what she mentioned, the challenges she mentioned earlier, there are avenues for investment by private sectors, tech companies, even CSOs. This is another project that you can embark on, to enlighten youths. Use traditional media, use social media to pass the message across. And I think when youth see what they tend to gain, like I have a dream, e.g. to be a pilot, but I need to live healthy to execute that dream, then I think they would see the benefits and try to make more efforts to be conscious about their eating. Even as parents, you don't just serve your children anything. You begin to implant that need for eating healthy and living healthy, having a healthy lifestyle. Another part is policies. We have lots of laws, and then they just sit there like elephant projects. It's like nobody looks into them. So I would subscribe to having policies that are targeted, that's been implemented. For example, somewhere like the UK, you can't buy alcohol without your ID. So you have to be 18 years old to buy alcohol. And then down the street here, you see that Malam shop that reads 18 plus for cigarettes. But how often, do they really execute these things? So you can see that we have lots of laws sitting down there, but we have little implementation. So it's a wake-up call, for us as persons to look inward and know that I'm responsible for my life, and for the government to whose sole responsibility to is the protection of its citizens. So we need to insist on these laws and its implementations, and CSOs play a heavy role in this.
So I like that part, insist and demand. I think that's the way to go. I'm sure that our time is all, but can this conversation continue sometime? Do you think we have exhausted it?
No.
So we all subscribe to some time to continue with the conversation, and that's the promise I can give to my viewers, that truly we'll bring this same group back and we'll we'll continue the conversation. I would ask that you please send us the way forward to build an enabling environment where we'll have healthier herd of Nigerian youths who are leaders in the making and who would take us, I believe, to the promised land. I want to thank you all for coming on, Bridges. I do hope that we've been able to build some solid blocks as we continue. Thank you, viewers. Keep healthy, eat healthy, and stay healthy. Thanks for watching. Bridges will be back same time next week.